In January 2026, Kaiser Permanente wrote a check for $556 million. Kaiser is one of the most trusted names in American medicine. They run dozens of hospitals. They cover millions of people. They just settled the largest Medicare fraud case in American history. Here is what they did. After patients visited their doctors, Kaiser employees went back into those patients' records. They added diagnoses those patients never actually received, medical conditions written in after the appointment was over, not to change any treatment, not to help a single person, to make patients look sicker on paper so the federal government would send more money. The Justice Department says this practice pulled roughly $1 billion from Medicare between 2009 and 2018. Kaiser paid $556 million to settle it. That is not an admission of wrongdoing. Those are Kaiser's exact words. Kaiser is not even the worst one. Right now, the federal government pays private insurance companies to run a program called Medicare Advantage. If you are over 65, someone has tried to sell you on it, or your parents. It covers everything regular Medicare covers. It throws in dental. It throws in vision. It looks like a better deal from every angle they show you. It is a business model. And the business model has one core feature you were never told about. Here is how it actually works. The government calculates how much it would spend to cover you under traditional Medicare. Then it hands that amount to a private insurance company. The insurance company manages your care. Whatever they do not spend on you, they keep as profit. Read that one more time. Their profit is the gap between what the government gives them and what they spend on you. The less care you receive, the more money they make. That sentence should explain everything that follows. The mechanism that made this especially profitable is called risk adjustment. The government pays more for sicker patients. Someone with a chronic condition generates higher payments than someone healthy. That design was supposed to prevent insurance companies from cherry-picking only the healthiest seniors and dumping everyone else. But the insurance companies saw the mechanism and ran the numbers. If sicker patients generate higher payments, and we control what goes into the medical records, then the fastest path to higher revenue is not better care, it is better paperwork. This practice is called upcoding, inflating diagnoses, adding codes for conditions that are vaguely documented or did not meaningfully affect care. Every major Medicare Advantage insurer in the country has been accused of some version of it. The DOJ is suing UnitedHealth, Humana, Aetna, and Elevance. Those are the four largest health insurance companies in the United States. All four, at the same time. The scale of what they extracted is not a rounding error. The Nonpartisan Medicare Payment Advisory Commission analyzed the 2025 numbers. The federal government paid Medicare Advantage insurers $84 billion more than it would have cost to cover the exact same patients under traditional Medicare. Not $84 million, not over a decade, $84 billion in 1 year. That is 20% more per patient than regular Medicare costs. To put that number somewhere human, the entire NASA budget for 2025 was around $25 billion. The government overpaid private Medicare insurers by more than 3 times the space program budget in a single year. And that is 1 year in a pattern that has been running since the program launched. Since Medicare Advantage began in 2003, these plans have cost taxpayers an estimated $600 billion in overpayments. The Committee for a Responsible Federal Budget projects that number will hit $1.2 trillion from 2026 through 2035. That is not a projection of fraud being discovered and stopped. That is the math of the program running exactly as structured. Now here is where this lands on you personally. You might not be on Medicare Advantage. You might have looked at it, decided to stay on traditional Medicare, and figured this whole story was someone else's problem. It is not. A bipartisan Senate Joint Economic Committee report released in March 2026 found that overpayments to Medicare Advantage plans directly caused Medicare Part B premiums to increase for every single person enrolled in Medicare, not just Medicare Advantage enrollees. Everyone. In 2025, the standard monthly Part B premium was $185. In 2026, it rose to $203. The committee identified the overpayments as a direct cause of that increase. That $18 a month is not from new drugs. It is not from demographic shifts. It is a fee you pay every month because private insurers have been overbilling the government, and the government passes the gap to everyone else. There is a phrase for a situation where you pay into a system your whole working life, and then private companies drain that system, and the cost gets shifted back onto you. There is a phrase for it. But the people running this have better lawyers than that phrase. The companies doing this have names and faces. United Health Group is the largest Medicare Advantage insurer in the country. The DOJ alleged it retained over $2 billion in Medicare overpayments through inflated diagnoses. Humana is being sued for paying illegal kickbacks to insurance brokers who steered seniors toward their plans. Aetna is in the same lawsuit. Elevance is in the same lawsuit. No individual executive at any of these companies has been criminally charged. Not one person has gone to prison for any of this. The companies pay fines. The fines are fractions of the payments they received. Then they hire more lobbyists. Over the last 5 years, the largest Medicare Advantage firms spent more than $330 million lobbying Congress on all issues. In 2024 alone, they deployed over 220 lobbyists on Capitol Hill specifically targeting Medicare Advantage policy. 7 companies control 84% of all Medicare Advantage enrollment in the country. Those 7 companies spent $330 million buying access to the people writing the rules for the program those 7 companies profit from. This is not corruption adjacent. This is the program. In 2026, after all the lawsuits were filed, after MedPAC published the $84 billion figure, after the Senate issued its bipartisan report on premium increases, the Centers for Medicare and Medicaid Services announced a 5% increase in payments to Medicare Advantage providers. They got a raise. Sit with the full picture. The government built a program that hands your Medicare taxes to private companies and pays them more if patients look sicker. The companies made patients look sicker. The government overpaid by $84 billion last year alone. The DOJ is suing the biggest players. Nobody is in prison. And then the government increased the payment rate for next year. This is not a system that is broken. A broken system fails by accident. This system is delivering exactly what it was designed to deliver. The people who wrote the payment formula knew what the formula would incentivize. The lobbyists who shaped the legislation knew what the legislation would create. The revolving door between insurance company boardrooms and the regulatory agencies is not a scandal. It is a staffing strategy. The rules were not poorly written. They were written by the people cashing the checks. Here is what you do with this. If someone you love is on Medicare Advantage and gets a denial letter, appeal it in writing immediately. Most denials are reversed on appeal. The company is counting on people not knowing that. Denying care is not a glitch in the incentive structure. It is the incentive structure. Spend less, keep more. And when someone tells you American healthcare is expensive because of pharmaceutical greed or hospital markups or the cost of innovation, remember this. A single privatized government program is funneling $84 billion more per year than it should from federal coffers into private company balance sheets. That number is in the government's own reports. It is documented, it is public, and almost nobody knows it. Because the people who built this system have a strong interest in keeping it exactly this complicated. The Medicare money goes somewhere. And the same structure that built Medicare Advantage was used to build something inside your employer health plan too.